Welcome.
All right. Well, thank you so much, Arlen. I'm really happy to be able to be back with a little bit of a different webinar, but still just bringing you resources that hopefully each one of you can just take back to your schools and whatever role it is that you work with. So today we're going to talk about empowering futures, right? Empowered futures. We're going to talk about tools to strengthen our students' mental health from various different sources. My name is Shantal. And I have a quick introduction slide next. But first, I want to just refer you to, Arlen already mentioned the QR code on here. This is where all of the Erica's Lighthouse free resources live. So I want to invite everyone to either use the link in the chat, which is ericaslighthouse.org/resources, or just scan the QR code, create a resource portal if you don't already have one. You'll walk away with all the resources that I'll talk about today and probably more, as I can't fit all of them into our presentation, but they are free, they're available. So, make sure you bring them back to your school, use them, and then also share them with others. So again, I'm the manager of school outreach at Erica's Lighthouse. I am part of the education team, and part of my job is bringing the resources to really everywhere in the U.S., including different countries, so that just professionals that are working with students can have all of the tools that they need to create inclusive environments around mental health. So you'll find me speaking at conferences at different states or national conferences, and then also just doing webinars like this, where we can kind of meet and we can answer some questions and bring you the resources and all the latest things that we have on the page. So I spent the last 12 years working with families, and I've been lucky enough to be able to work with families starting from like pregnancy and like 0 to 3 age, school age, and now really focusing more up on youth and adolescents and mental health. But my background is all in psychology, and I really just always wanted to work improving children and families' well-being. So this is what currently Erica's Lighthouse is doing, and I'm really happy to be part of their team. And again, I just, help connecting schools with resources. We're educating students, we're educating families. Also, we're supporting professionals like you that are in those schools day to day, and everything around the topic of mental health. When I'm not presenting, something that I like to share that I like to do for my mental health is either if I need some movement, I need something like dancing salsa, but also just something as simple as my daily walk with my dog, or even an occasional karaoke. So I hope that you have, at least a couple of things that you identify and like to go back to when it comes to taking care of your mental health. Now, if you're not familiar at all with Erica's Lighthouse, if this is your first time joining a webinar around Erica's Lighthouse, I'll give you a quick summary of our organization. We were founded in 2004, and that was after the loss of Erica. Erica was a 14-year-old student who lost her life to her depression. So her family and friends organize this organization and really believe that this education should be free. And we believe that every student deserves good mental health. We're dedicating to educating and also just raising awareness about adolescent depression. Also, we want to encourage good mental health to everyone. And we want to break down the stigma that we still see around mental health issues. So we do all of this by providing free mental health programs for any school anywhere. Now, these learning objectives for today were shared online as you signed up for this webinar. But today we really just want to give you some of the latest youth mental health statistics and discuss some of the protective factors that we have around mental health for students. We also want you to walk away with some strategies where we can help empower students and give them the right tools to take charge of their mental health. And lastly, we hope that you gain some knowledge around how to empower through youth-led initiatives, right? We want to involve that student voice in a lot of what we do to improve youth mental health. And then overall, from whatever your role is within a school, we want to create inclusive school cultures around mental health. I'm sure a lot of you have signed up to this webinar because you know that there is a mental health crisis among our young people. So I have some data here just from the latest CDC Youth Risk Behavior Survey data that I want to show you. And as you can see on here, nearly all of the indicators of poor mental health, as well as suicidal thoughts and behaviors, have really worsened across 10 years. So this, the latest report is looking at 2013 all the way through 2023. Specifically, there were increases in the percentage of students who experience or who said they experience persistent feelings of sadness and hopelessness. Also, an increase in those who seriously consider attempting suicide, made a suicide plan, and attempted suicide. So the last 2 years and the little change that we've seen on there showed a small decrease in the percentage of high school students who experience persistent feelings of sadness, but it's not a lot. And then all other experiences and behaviors didn't change, as you can see here from the red and the yellow marks. So this chart summarizes the findings where we know that 4 out of 10 students are feeling, persistently sad or hopeless. We have nearly 1 in 3 that experience poor mental health, and almost 1 in 5 students seriously consider attempting suicide. With this, I also like to note that female and LGBTQ plus students were more likely than their peers to experience persistent feelings of sadness and hopelessness, also poor mental health and suicidal thoughts and behaviors. So I want to make sure that we kind of like know what these groups are currently experiencing. Now, we always say that early identification is critical, and this is why we bring education. This is why we want to be in this mindset of really getting to students before, right, they experience anything around mental health and making sure that they know what to do and how to take care of their mental health. We know that 15 to 20% of young people will have a major depressive episode before adulthood, and that's about 1 out of 5 youth. We also know that 50% of those will have symptoms by the age of 14, and this is why schools are still particularly important and well positioned to be able to identify those students early. We know that young people spend many hours, right, and many days in school, and we have a lot of eyes that can catch things, including peers themselves. So I'd like to show this chart representing a school of around 2,000 students. We in Erica's Lighthouse believe that depression education is suicide prevention because we take this upstream approach. We know that depression accounts for many of the issues that impact students' ability to learn as well as perform on any given day. We know that it affects attendance, underachievement, behavioral concerns. And we also just know that teaching depression literacy really reduces stigma and builds these climates around good mental health where everyone is educated and every young person knows how to help themselves, but also how to help peers. So there are many, many students who struggle with depression. And while suicide is actually rare when it happens, and for those of you who may have experienced it in your buildings, it's very tragic. It affects more than just the immediate family, it affects the entire school community. So in this chart, we'll show you why it's continued to be important that we take this upstream approach with things like empowering students and educating students. In the middle, you'll see the black dot. The black dot represents a suicide. Surrounding that suicide, there is about 180 kids, or that's 9% of that community of 2,000 students who will attempt suicide. And then surrounding that one, we have about 20% of the students, or 400, that seriously consider suicide. Then from there, we can see that 40% in the blue, or 800 students out of those 2,000, report symptoms of depression. And we know that 70% of students, when asked, believe that anxiety and depression are serious problems among their peers. The last question there, where we see 96%, it's when we ask students, they believe that anxiety and depression are problems among their peers. So the difference between those last two gray ones is 70% believe they're serious problems and 96% just believe they're problems. Maybe they don't identify them as serious. So as we can see here, this is something that students are experiencing and that we really, really, really need to equip them with some tools. So now I know that we might have some ability on the call to use maybe like the raise of hands or any other. I'm on more of like a Google Meets. In Google Meets, there's like thumbs up or there's like hands up. But in any way that you can, or using the chat box, I just have this question for you. How many of you believe that you can do more to support students' mental health? And some of you might already be doing a lot, so that's great. But how many of you do believe that maybe you could do a little extra? And maybe you can put in the chat. And again, I'm sorry I am not like, so much of a Zoom, but okay, I do see some thumbs up floating around here now, so that's great. It's great to just even identify that there's a lot more that we could do. And again, if you're currently doing already a lot and it's working, that is amazing. And you know, we can always, sometimes we have to switch things up, right? Sometimes we've been doing something for too long and then we have a tough crowd. The students are like, we already did this or we already know this. So hopefully today you can walk away with something new. Oh, I see someone else in the chat. Yes, I see hand raised, thumbs up. Thanks so much for participating. That's great. So let's see if again, at the end of today, you can walk away with some resources or just something extra that you can do, maybe a lot, maybe an entire program you can implement, activities that you can bring in, or maybe just one or two things that you'd really like to try, whether it's you're just planning now for next year, or maybe you can squeeze in right before the end of the school year. So after I showed you kind of all of those data points from the CDC, we also want to show you that the CDC also reported on and identified two protective factors on improving youth mental health, right? So it's important that we understand that these are very, very terms that we have to understand, like very, very important to both parents and then students themselves. The first protective factor that they identify is parental monitoring. And this was defined as when parents or other adults in the family know where students are and who they are with. It is associated with decreased sexual risk, substance use, experiences of violence, and also suicidal thoughts and behaviors. So very important for parents to be involved and for us to be giving the parents tools so that they can also tackle this mental health at home. And then the second one, which is one that we actually can help because we are in the building, is school connectedness. This is defined as when students report that they feel close to people at school, that they have long-lasting, like relationships. This is truly a protective factor for any student in a school, because a lot of the times what we see is that maybe students feel like their teachers care about their academic performance or how they do, how well a good student they are, but they might not necessarily feel like people care about who they are, what they like, them as whatever particular thing they're interested in. So I think that's why school connectedness is very, very important. And fortunately, we know that young people are resilient and we know how to support their mental health. So let's look at some of the things that we can do to support them. Youth and any student, they really need to know that someone cares about them. So it's very important that we voice that, right? I care about you, and that we show them as much as we can with all of the days that we can see them in school. We know also that when empowered and when given the space and the time and the opportunity, teens can really take charge of their own mental health. We just need to equip them. And then when given the opportunities, youth can really build supportive environments, making them part of this change of creating this inclusive school culture in their own buildings is very important. When youth feel connected to their school, we know from the reports that students are less likely to experience poor mental health, sexual health risks, substance use, and also be involved in violence. some of the things that as schools that we can do is we can have, our staff be trained on signs and symptoms of depression and suicide. The more adults that are involved in looking out for students and being able to recognize the signs and symptoms early enough is better. We are also teaching the students this, so now we have a bigger group of people that is looking out for one another. It is also important that every adult in the building feels comfortable and understand what does it mean to be a trusted adult, right? A trusted adult, students, believe is someone they can come to, someone they can trust, someone that's reliable. Often we hear that it's just someone who doesn't make them feel silly for coming to them for any questions or for any problems that they're having. So, every adult in the building might not be comfortable with conversations around the topic of mental health. So we need to make sure that everyone knows what does it mean to be a trusted adult, but also what are the limits of me as a trusted adult, as, an educator, right? That's not a mental health specialist. We need to make sure that you know that your role is really not to help a student completely or to take charge of that, like that student and solve their problems, but really just to get them to the right person so they can get the help that they deserve. So we also know that buildings and schools need the tools to be able to identify students in need. I'll show you later on a really nice data center that we have that sometimes can really helps us see what students are learning, what the curriculum is really doing, and help us make some of those decisions where we can have these tools to identify students. Then we also need student-facing mental health and suicide prevention education. This might be something that you're already doing in your building, but ideally, we want to have something where students are really learning and we're really building on those blocks, beginning, from what grows as a little bit after SEL, identifying what is mental health, and then moving them all the way up to something like suicide prevention, which we would see more in like the high school age. And then all schools, we need to build those inclusive environments. We need to have the policies. We need to make sure that every adult in the building knows exactly the protocols to follow when they come across a student that might be needing some mental health support. And then we need to make sure that we have some resources available to support staff around mental health. And then, as I said, this webinar today, we're focusing really on empowering students. So here's some things that we can ask and we can build for students to be able to take charge themselves, right? So we need to give them just the space so that they can have conversations around mental health, which I know reduces the stigma around the topic. We know that students can create or even just, they might already have clubs, but just even start or bring in resources to a club they already have just to, again, get these conversations started, to talk about mental health, to ask the questions. We know that we need to equip the students with the tools to seek help for themselves. But what we often see is that students and peers help others and help their peers when they see them in need. So we need to have them understand what to do. And we also can have them use their own voice to really spread the awareness around mental health, around positivity, around good mental health strategies, and then around education. So they can use their voice because many times peers listen to their peers, right? We know that 66% of young people first report suicidal thoughts to a friend. So what this tells us is that friends are on the front lines of that beginning of identifying and treatment every day. When we are equipping students with the tools to help themselves, we're also preparing them to support their peers. If you're not familiar with all of what Erica's Lighthouse has to offer, here's just a quick snapshot of our program model. Everything we offer is free to you and to your school, and we have 4 different pillars that we'll look at. Today, I'm going to focus a little more on the empowerment clubs portion because this is where we really want the student voice to come from. But we also have other pillars that I'll talk about, and that includes classroom education, 4th through 12th grade, family engagement resources, and staff training. And then, like I said, the empowerment clubs, which we have different options for, including with that with the four pillars surrounding, we have what we call wraparound supports, which really help us a little bit strengthen what we currently have in place. So there are some strategic alignments on there, some school-wide campaigns that really affect every student in the building. We have some cultural framework that you can kind of like look and analyze and bring into your building's plans. And then lastly, we have a data center that can be really helpful, and I'll give you the list of everything that you can find on there. So most likely, many of you are familiar with the MTSS framework, which really helps schools proactively identify struggling students so that they may receive help quickly and really encompassing all students at every level. We work with a lot of school communities that tell us that they have amazing like tier 2, tier 3 programs and resources. But when asked about tier 1, they usually kind of can identify an area where they could improve or bring something a little bit more. So universal programming for all students, the engagement of families and resources for families, staff development opportunities. Again, most schools could use a little something extra. So Erica's Lighthouse programs all lay on that like tier 1 space and foundational under this inclusive school culture. So there are some foundational supports and best practices recommended to have inclusive school cultures, and that's where all of our programs lay. So now, one of the pillars for Erica's Lighthouse, as I said, are student-led empowerment clubs. One of the ways that we can establish supportive environments where students have the important conversations is through these, clubs that are already within their buildings, that are already with their peers. So what we like to do is we like to offer empowerment clubs, and then what the empowerment clubs is they do is they provide awareness into action activities. So we have over 72 activities that students can choose from, different topics, and then also varies by elementary, middle, and high school buildings. And we're really allowing students to pick and choose what they want and how they want to influence within their building. Empowerment clubs really have this power to continue supporting mental health literacy, so beyond the classroom education, but this time it's led by the students. So what it does is really, it continues spreading education, it continues reducing stigma, but it really allows students to practice the skills they learned already, perhaps in their curriculum, and then just create a positive school culture for on mental health. So through these clubs, students really are getting the opportunity to reach other students in the building, and that might maybe already have received the education, and then just encouraging those conversations. The more conversations we can have in a building, the more we know that we're reducing that stigma to be quiet about mental health conversations or to just keep those conversations at home. So we want to make sure that we're really encouraging this. So here's just like some of the pictures that I'll actually beginning with this even first slide. These are just some of the pictures that we receive often from clubs. And as you can see, they're very different seasons. Some of them were virtual back in COVID, that they share with us. Some of them do their own twist to the activities that they bring into the buildings. But the club opportunities that we have and that I invite you to just look into or bring back to your building, to whoever the person would be, whether you're already admin or if not, if you're an educator and would really like to have your school involved, I can connect you with our club coordinator. He's great at just kind of like leading you and like which club would be better for you. But official Erica's Lighthouse Club actually can receive up to $500 in school from us so that they can create these activities and buy the materials and then keep the club up with with the students, whatever the students are needing, even if they're just meeting and like buying snacks for their clubs, that all counts, right? We just want them to be able to meet, to really be able to make the impact in the building. And then if there's already a club within your school, that's okay. You don't have to create a new club. We know already that you as educators are so busy and sometimes can't take on being an extra advisor to another new club in a school. So that's fine. We also have affiliate clubs. If you already have an existing activity that goes on in your school with a similar mission, so something like a positivity club or something along the ways, they just want to use Erica's Lighthouse resources, they can become the affiliate club. The only difference there is that they don't qualify for that $500 stipend. But many times, if there's already like a key club, a SAD chapter, Hope Squad, a kindness club, there's others that we already partner with. Some of the benefits of, again, giving this, empowering those students to create those clubs and to be the leaders around mental health in their buildings, are that we're identifying trusted peers that other peers might be able to go to get help or to get some guidance on who should they go to. We're also, encouraging connecting with one another, which built on that school connectedness protective factor that I talked about earlier. We are also helping them be leaders in promoting mental health. We're helping them find their own voice many times, whether it's them sharing the stories of like what they're going through, or just even, what they've experienced, or just finding their voice and really advocating for mental health and for their peers. We're also allowing them to be able to expand this like help seeking. There's more than, when we're asking students to go seek help, there's more than just go get help, right? Sometimes our students are having such a difficult time just even asking for help with homework. So really by having peers be the cheerleaders on like go get help, go seek help when you need it, it makes a difference. And then really the clubs help students feel empowered to spread this message across their school and make changes. Here's some other pictures of clubs that have shared with us. They all, again, some of them do their own version of the activities. Some of them are smaller clubs. Some of them are larger clubs. Some have been around for a while. Some of our newer clubs. But just so you can see some of the schools that currently have some clubs that are just very successful, and usually the students love sharing what they do with us. And I just want to remind you here that if you have any questions as I'm just giving you all of this information, if you think you're going to forget, put it in the chat. We'll go back to those at the end. So just want to make sure uh, that you don't forget and you ask all the questions. Now let's move into something that also has a very large impact, and those are the school-wide campaigns. So again, whatever your role is within a school, these are things that you can implement. So whether you're admin and you like, I want to bring this back to my building, or you're an educator that just needs to, do this with a small group, whatever it is, these are all available to you, and you can make them, mold them to whatever the needs of your building are. So we have two school-wide campaigns, and typically we like to promote these. This Positivity Pledge one is perfect, almost perfect timing. If you didn't already have something for promoting mental health in May, which is Mental Health Awareness Month, Positivity Pledge is an entire month of May with activities each day, so that students get to participate, and each of the weeks they focus on something different. So the first week they focus on nutrition and well-being. The second week they do gratitude. The third week focuses on exercise. Right, as we know, this is very well linked to having good mental health. We also focus on mindfulness on that next week, and then the last week is just a reflection week. So this is available for any school that wants to participate. What you do is you will just open up your resource portal. You'll go to Positivity Pledge under the school-wide campaigns, and then you'll get this website on the left side of the screen that you have here. So each of those little boxes have week 1 and week 2. You also sign up and get a month calendar, which is on the right side of your screen now. And again, this could be like individual student participating. This could be just your group or just your classroom, or if this can really be like school wide if you do it in the hallways. Then the second one And again, you still have some time to plan for this one for the rest of the month to start May 1st. The second one is called Give Voice. And this one is a school-wide campaign for Suicide Prevention Week. So this one is just a little shorter, right? Because it's only 1 week, but it's the same, where every day we're focusing on giving voice. We're using student voice and we're giving voice to suicide prevention and suicide awareness. So on Monday, as you can see on here, it's focusing on education. On Tuesday, on help seeking. Wednesday, we look at awareness. Thursday is all about positivity. And then Friday is just give voice to yourself. So it comes with everything that you would need to host this school-wide for one entire week. And this is in the month of September for that Suicide Prevention Week held in September. I actually don't have it in front of me exactly which week in September it is, but the website, it is right here, September 8th through the 12th. That's what the week that it falls on this week. Now here's one more. If you were familiar with Erica's Lighthouse, maybe you have not seen this, or maybe you have not seen the latest version on the Teen Toolbox, but this QR code here leads you to the Teen Toolbox. It also lives on the resource portal, but if you want to just have kind of like that quick link or save it on your phone or on your laptop, it is a Teen Toolbox, which is just self-guided website all around mental health education, but also it has topics for students to explore on their own. So this is a QR code that you can provide so that students pick and choose exactly what they want to learn about. And it goes beyond just mental health. So it actually covers the topics of stress, anxiety, depression, self-harm, body image, co-occurring disorders, suicide, and there's a lot more in there. For each of these, it typically comes just with some small information, some links and resources that we found very helpful. And then all of them come with a small clip or video around the topic. So it also has like guides for students for hosting conversations with families. It is available in Spanish as well as in English. So this is something that can be incorporated, shared with students at any time in the year, and that they could just have as a tool. So when they have questions about any of these health topics, they have at least something to start off with, and they also can explore on their own. So if there's anything that they're particularly curious about, they can just go to this Teen Toolbox. This is also something that can be shared with parents so that they can share it with their kids, and review some of those topics with them. And remember, put any questions on here. There we go. All right. The next tool that I have for you to empower your students to just learn more about mental health is this Mental Health Recharge. Mental Health Recharge is a little program that lives, and I say little because it's just kind of something that we have as an additional program. Optional program addition on the resource portal, but it's really, really powerful if a school uses it in every classroom, and if it's used throughout the entire school year. So it is a 5-minute classroom breaks to boost mental health. What we're doing here is this is available. You can pull it up on your phone. You can pull it up on your computer. If you ever see us at conferences, we actually have a little keychain version that we give away at our exhibit booths that comes with some of these activities, and then they could just put it on your keychain. So if you ever see me at a conference, we'll for sure have them there. But really the full version lives on the resource portal. What this does is it helps students understand that mental health is important. It gives them that space so that they can work on their mental health, but it also gives them the opportunity to try different things because what works for you might not work for me. So although that sometimes, as educators, you can share what works for you and your mental health so that students can take your example and then, try something out. We really need to let them select what works for them. And sometimes it might take 1, 2, 3 tries before they can before they can find something that really works for their mental health. So Mental Health Recharge, it only takes 5 minutes. Anytime your students need a break, they can come up to this and then select kind of what they want. This is just a screenshot, so I can't really click on it, but it does have all of these 8 activities or 8 topics on here. And then for each of these topics, there's about 8 activities activities to them. So what they look like, for example, on the next slide, I just have the mindful. So it would be under the mindfulness. Again, you would have, 6, 7, 8 activities to each one. And then they look like this. So you set a 5-minute timer. You have some instructions on here and also some information about like why mindfulness is important, or what it allows you to do. It has the instructions that can be read by an educator. Once the time is up, there are some quick instructions to kind of let it go, regroup, do a last breath, and then come back to whatever activity you were doing. So this can be done by anyone. Again, it's also available in mobile. So if you have a health educator or students are spending time outside, this can be also pulled up. And as you can see, and it's also available in Spanish, but as you can see, if more than one educator did this in a building, and this is like the go-to for students when they're needing a break, or maybe when it's like testing time and stress is really high, this can create a bigger impact for students. And this can just, they can also have access to it if they need. And now, as I talked about clubs and I said there's about 75 different activities that the clubs can do in their time. I just wanted to pull some of my favorites to give you some ideas. If all you want to take back is one activity and do that in your building before the end of the school year, then that's great. So here's just some. Again, all of these are available on the resource portal. The first one is we have a Take a Compliment flyer. Take a Compliment flyer really focuses on for students filling in. There's a template sheet, or they can create their own. And on those like tear-offs, they just write a compliment. What happens a lot of the times is that it gets given to a peer, and then that peer will then just give it to another peer. And it, this little chain is formed around just giving a positive compliment, or just, any nice thing, just a cheerful message. And this could be put in lockers. This could be put in like the bathrooms. This is really easy to implement. Students can write on, so we're getting them involved. Again, we're getting their voice in there, and it can be done anytime in the year. Some of these activities, you'll see that, they're nicer around certain times of the year. We have some specific for like Valentine's Day, named like heart to heart conversations. We have some more for around like Halloween or the holidays, but this is one that really fits anytime during the year. We have another one it's Follow the Footprints. Follow the Footprints, again, can be used anytime, but I really, really like that one. The beginning of the school year. A lot of school social workers and a lot of school counselors will use this. There are footprints that have facts around mental health, or you can pre-fill them with whatever information you want, and then they'll put them in the hallway, kind of staggered and towards someone's door. School counselors and social workers do this because many students can identify where the office is for, if they needed to see the counselor or if they needed to see that. It could also be like leading to the principal's office, leading to a specific, educator. So you can really do whatever you want with these, but it really helps with like, hey, inviting you to walk here. Like, I'm here, right? I am a trusted adult, or I'm someone in the building that you should know. At the end, maybe you can put some pieces of candy or something for the students when they get to your office. But again, if we can leave them as they're already filled with mental health information. So not only are we creating some more awareness around mental health facts, but we're really helping students identify a trusted adult in their building and someone they can go to help. The third one is Good Mental Health Week. This one is one that I like for what we just experienced with spring break, just because it's an entire weekly planner of things that you can do to support mental health. It does come with a list. They're like just like pre-written so that they can get some ideas started. But what this is meant to do is really to have students plan just one thing that they can do during their break or during any week around the topic of mental health that can help improve their mental health, or things that they want to try to see if it works for their mental health. This you can send home perhaps to families so they can work on that together, or just as an assignment for students to kind of start identifying some of those things that they're learning and that are really working for their mental health. The fourth one here is acts of kindness chain. Where for this one, what we do is they're just large pieces of paper, long pieces of paper. You can do the colorful ones, and then you give a piece of paper to every student to write something kind that they would either like to do, or something kind that someone did for them, or something kind that it's just an idea that they would like to do. What this really builds is not only is it really helping students identify like kind things to do, right? Keeping that positivity in the building, but also helping them understand that there's a lot of kind people in the building and the different types of things that they can do, whether that's helping someone after school with their homework, or maybe just opening the door for them. So at the end of the month, or whatever you set it up to at the end of the year, if you really wanted, then you could really see how that kindness chain grows. And it's a great visual of, kindness matters. The next one is Beacon of Hope signs. These are already embedded into the curriculum, but if the curriculum is not something that you're using, these are just beacon of hope signs that if you want to be identified as a beacon of hope, right, as a trusted adult in your building, there is a poster and some cutouts that you can do. What the clubs do is they walk around with the little templates, and then they ask any educator if they can put this in their classroom. What that will mean then is that any student that sees this lighthouse, it's someone that they can go to. So it's kind of inviting them in and saying like, hey, I'm a good trusted adult, and you can come to me for anything you need. So any teacher or any staff member can really help out and have this visual out there. Of course, it pairs well when you're teaching Erica's Lighthouse curriculum, because we talk about that. They can identify the lighthouse, but this is just a representation of like, hey, I'm here to help. I'm a trusted adult. And then we have the mental health bingo. The last one is also pre-filled if that's what you want, but also you can do it in a blank version where you're entering what you want or your students want to do for their mental health. And then this can be done or sent as an activity to do with families, or even just within a week for your students. So again, these are just some of the many things that we have. So some of them might be just like a one-day thing. Some of them might take a week. Some of them, as you can see, the school campaigns might take a whole month. But the only thing that I really recommend is kind of plan this together. If more than one educator is doing this, or if there's more than one people involved, then the bigger impact that it has. So now I just want to see if you can all share, or some of you, whoever are comfortable sharing, anything that you are currently doing to create inclusive school cultures around mental health in your building. Is there anything that you'd like to share that you feel like it's really promoting good mental health, that is building or that help build a stronger, inclusive school culture around mental health in your building? So I would love to just hear some of the things that you might already be doing that maybe others can use also as examples for today to bring back to empower students. Is there anything anyone would like to share? Well, I'm looking at the chat. Brett had a question about where we're located. We're actually our offices are in North Shore, Chicago, so in Winnetka. I'm currently talking to you from Chicago. All of our team is in Chicago, actually, but we service 50 states and 19 different countries because everything lives online, so we can really get to everyone. So, does anyone want to share anything? I can't see if anybody is typing. So, all right. Thank you. And then make sure I can read these. Make sure when you're sending in a message that you do switch it to everyone in the chat. I think a couple just came in that is only going to the host and panelists. But Lynn shared here, we have grade level groups that get together weekly to play a game and build social skills. Great. So these are great. Great that you have them kind of like already in schedule, so that they are weekly and weekly opportunities for students to come together. I think that really helps with building the school culture, or perhaps even, peers talking or spending time with other peers that they might not already spend time with. And then Emma also shared, again, everyone can't see it, so I'm just going to read it out loud. It says, we do a weekly SEL challenge that focuses on acts of kindness. Students are recognized for their kindness. I think that's really sweet. You know, at the end, doing a shout out on kindness, that's amazing. So maybe you can incorporate that kindness chain if you bring that back. I feel like that's a nice way too to keep track of like all the kindness things that you can hear, because then you can visually see them and actually have the little loops. And then we can include staff on there too. And then Brett, I think this one, yeah, you post it to everyone, so everyone should be able to see it in the chat. But it says I do a daily SEL topic every day in my classroom for 20 minutes. Daily is great, right? So if there's anything else like I don't know what grades you're all working with, but something like the recharge, those activities can really be incorporated with any grade level. Of course, when we're talking about other things like suicide awareness, we're, a little more conscious of what grade level we're working with, or even like the topic of depression. When we're working with our classroom education, we do have different levels that kind of like, begin with introductory language and then move on. So some of these activities that you see for the empowerment clubs really can work for different groups, different grades too, but you know what your students need best, so you know what they're ready for. All right. Thank you, Brett. Thanks for joining us. All right. Thank you so much for participating. And sharing what you do in your buildings. So now I also just want to show you some of the classroom education pieces to this. So if you are interested in empowering students through education, this is what Erica's Lighthouse has available. We are an approved program under the Suicide Prevention Resource Center Best Practice Registry. So you'll find us in there. Everything we have is available in English and in Spanish. And we have education from 4th all the way through 12th grade, divided in 3 different levels, as I said. The grade levels that you'll see on screen are suggested grades. By all means, you know what your students need best and you know what they're ready for. Level 1 is called We All Have Mental Health. It is video-based, and it's just an introduction to mental health by understanding everyday feelings versus overwhelming feelings. It has a strong focus on help seeking, and then good mental health habits. Then level 2 is ideal for grades like 5th through 9th. It's called depression awareness. And this one already includes, it's also video based, but includes real stories from real students speaking about their experiences with depression, like who helped them, what helped them, how they continue having good mental health. They all have a very positive approach and language around it. And it has an introduction to depression by recognizing those signs and symptoms. Students will walk away learning those just like staff would, and then help seeking, really big on help seeking, and also good mental health. And then the level 3 is really ideal for grades 8 through 12, typically used like in the high school level. And for some states that might have like mandates for suicide prevention, this is used a lot. And it's depression education and suicide awareness. So this is continued introduction to depression, but then includes suicide on there. And then we continue to have a strong focus on help seeking and good mental health. So if you want to check out any other programs, again, they're all available to you. And they all come with an option to implement in one day. So it's a one-day lesson if that's all the time that you have. Or what we have is a full program, which is 4 sessions, 3 classes, and an assessment. So each one of these, if all you have is one day, by all means, you can do that, and they includes just the important information on there. And then of course the one for the 4 classes just gives us a little more room to work on each of those topics, but equally as helpful. Now, because we know families and that, that parental involvement is another factor, I want to show you some of the family engagement resources that we have, because when we're talking about empowering students, we also need, we need to equip them with the language, with the education, but they also need support at home. And we also need to make sure that those families are comfortable having those conversations, because when students go back home and start talking about their mental health and what they've learned, we want to make sure that families are prepared, they have the tools, and they have the right language. So We need to really equip them with what they need to help support their kids. We have 3 family workbooks that are available in English and in Spanish. They're very easy to read. They're very digestible. One is we all have mental health, the basic introduction around mental health. Then the second one talks to parents about what to do and what should you be concerned about your child, right? What's typical behavior for certain ages and what is something that you can be concerned about, how to keep track of your concerns, has a ton of tools within it. And then the last one talks about getting help. So once you find out that you do need help to get your child help, what does that look like? Navigating definitions of what types of therapists are there, what types of you know medications are there, how to navigate the insurance world when it comes to mental health services, which is a very tricky one. So again, this is really helpful for all parents, can be sent out in an email as links for parents, and very, very easy Spanish and English available if that's a need that you have in your building. And then we also have 2 family workshops. One kind of goes along with our level 1. We all have mental health. And then workshop 2 is depression and suicide. So it goes along with our level 2 and our level 3, talking about signs and symptoms and suicide awareness. So these are family workshops that are already pre-recorded in Spanish and English, but also you would get all of the tools that you need to host the workshop in your building if that's something that you're interested in doing. But for many parents that don't come to your meetings, I in my past jobs, I was an organizer for parent meetings, and we know that not many show, and sometimes it was a struggle. So we want to make sure that this information gets to them in whatever format they need it. So if they need this to be a link so that they can watch it, before they go to bed, or they can watch it at their own time, then that's available. Within those resources and within the workbooks, they will find awareness into action activities, which are very, very similar to the ones that we have for clubs, but this ones are for families to do at home. And then we also have a really nice bookmark that you can just print and send home. So if that's all you can do to implement family resources, this has a QR codes to every one of those workbooks and all the two workshops. It's in Spanish and then it's in English on the back end. And then lastly, but very, very importantly, the school policy and staff training development. So as a reminder, the MTSS foundational best practices include staff professional development because it's very crucial that all adults feel prepared around the topic of mental health. So we do have staff training through an LMS system. You can go in and take the training as you need on your own timing. It has 4 different modules and you can finish. It's about maybe the whole thing with the quizzes, maybe a little over an hour or so. And then you can do that on your own. However, if you are admin and you would like to host this for your entire staff and your whole building or even district-wide, we can also do that where you have all of there's like an implementation guide where one person would then train all of the staff and they have all of the tools that they need, like a presentation, a script, facilitator guide. In there. So in the website, you can also find our white paper, some of the studies that we've done, and then some staff well-being activities, because it's important that when we're focusing on mental health for students, we're also focusing on making sure that staff have resources for good mental health. So in the beginning, I said I would be talking to you about a data center that we have available. This is new from this last school year, and this is very, very helpful if you're trying to make some decisions based on data. So there is a lot that you can collect here. There's pre and post data for students if you're implementing the classroom education, if you're implementing empowerment clubs, and also if you are hosting any of the staff training or the workshops for the families. So you can see pre and post data immediately and in a really nice, easy format. And then also available as more like building wide. If you're admin, you might be interested in having that school culture survey data you see there first. This one would be recommended within the first month or so of school. This is a survey that would go out to parents, staff, and students to kind of, again, gauge on the culture they're currently living. And then once you're implementing some mental health education programs throughout the school year, then you would do it again at the end of the school year or before the end of the school year to kind of like see that data and the programs that you've implemented, whether they're working or not. And then we also have a tier 1 assessment. So what you're currently doing as your tier 1 interventions, might like be great. But what this does is it lets us know what you're doing currently, and then you get a report with some recommendations of maybe areas where we can improve or add some things that may be helpful to you. So all of this is available as part of the resource portal and as a free tool for you to use. Now, at the beginning, we shared the QR code to access Erica's Lighthouse resources, and also Arlen shared a link on there, which is ericaslighthouse.org/resources. Here's the QR code again. You can scan it if you have a phone, or you can just go directly to our site and then just register for free access. You will select who you are, your school, and then have also once you log in, you'll have a username and a password. And then there's also some contact people in there from Erica's Lighthouse. If you ever need help, there's a contact person. With that, thank you. I think Arlene just posted that again. So if you want to just click on the link if you are on a computer. With that, I want to just leave some time for questions on here. Does anyone have any questions? I think I got the ones that, just the one question that was on here. So I'm going to give it 1 second for the webinar. Let's see. Have I presented before at a conference in Bloomington? I am not in the last 3 years. I would say that I've been with Erica's Lighthouse, and I'm not aware that any other staff has presented. But I would be very interested in learning about it. So I'm going to write it down here. Thanks for sharing, Brett. I'm going to put it on my computer. We try to participate as a nonprofit organization. We wish we could be everywhere. But sometimes we do have ambassadors that help us present at conferences like this, whether it's in Illinois or anywhere else, because we're only a staff of about like 12 to 14 people. So we try to be everywhere and try to get to everyone. But that's really nice. I'll actually definitely look into it, especially because it's something within Illinois and we are here. So thanks so much. Does anybody else have any questions? Arlene, I don't think I have any questions in the chat.
Yeah, it looks like you got to all the ones that were posted in there earlier. So if anybody's got any final questions for Shantal, type them into the webinar chat now. Shantal, thank you so much for the presentation. You shared so many tools, so many resources in 1 hour. I'm just always blown away the productivity at Erica's Lighthouse.
No, I'm very, very happy. Thanks so much for having us back. I'm going to switch this last screen here. If you don't have a question or if you don't want to ask in the chat, my email address is also on there. Or once you log into the resource portal, if that's something that you want to do, you can reach out to me, Shantal at ericaslighthouse.org. I can help you with any questions that you have. A representative that takes care of all of the schools in Illinois is Katie Conklin, our Vice President of Programs. So you can also reach out to her. And then if you have any questions about starting a club, becoming an affiliate club, reach out to Derek. He is our Empowerment Club Coordinator. He is great at just like linking you and telling you exactly what you need to do to be part of one of our clubs. So that's Derek at ericaslighthouse.org. And that's my last slide, Arlene. Let me see. I see something else in the chat.
Yeah, Brett's got a follow-up question about some other recommended seminars on mental health.
I would like more training on helping my students with mental health. Well, I can tell you, any others like don't come to mind right now, but I can tell you that we definitely host different topics within Erica's Lighthouse. So my best suggestion would be get a resource portal for Erica's Lighthouse or follow us on LinkedIn. And we post all of the opportunities that we have. We host more webinars. We also have like a help seeking study that we launched that's on our website that sometimes I'll do a webinar about that one. Arlene, maybe in the future, that's one that I can share with you all. But we do a lot within Erica's Lighthouse that we share on different topics or even partner with other organizations. So I would say let's stay connected. LinkedIn, we're also on Facebook. And then again, the resource portal has access to everything and you'll get notifications of anything like any webinars or opportunities coming through.
Yeah, highly recommend setting up an account on the Erica's Lighthouse website, so you can get access to all those great resources. Yes, Nuf, there is. I'll be sending out a link to the webinar evaluation tomorrow morning. You'll get that along with the recording of this presentation. And when you complete the webinar evaluation, you'll be able to download the ISB evidence of completion form for getting your clock hours. So thanks for that question. And thanks to all of our participants for hanging in there the full hour with us. It went a little over time, but I appreciate everything Chantal has to say and share. So thank you so much.
Thank you again. Thank you, everyone. Please reach out if you have any questions.